Is it reliable to check blood pressure without a machine?
Welcome to this video about measuring blood pressure without a machine. In this video, we will explore the methods available, their reliability, and the pros and cons of each.
Can you measure blood pressure without a machine?
Yes, it's possible to measure blood pressure without a machine. However, these methods may not be as accurate and reliable as using a proper blood pressure monitor. Let's look at some of the alternatives. 1. Palpation method. The palpation method is an old technique to estimate blood pressure by feeling the radial pulse at the wrist or the brachial pulse at the elbow. While this method can give a rough estimate of blood pressure, it is not very accurate and should not be used for diagnostic purposes. 2. Auscultation with a stethoscope and sphygmomanometer. Auscultation is the method used by healthcare professionals to measure blood pressure using a stethoscope and a sphygmomanometer, a manual blood pressure cuff. This method is accurate and reliable when performed correctly, but requires practice and skill. You'll need a stethoscope and a sphygmomanometer to perform this method.
How accurate are the alternative methods?
As we have seen, the palpation method is not very accurate and should not be relied upon for diagnosing blood pressure conditions. On the other hand, the auscultation method is accurate and reliable when performed correctly. The accuracy of blood pressure readings taken without a machine depends largely on the skill of the person taking the measurement. In general, using a blood pressure monitor is the most reliable and convenient option for most people.
Are there any risks associated with measuring blood pressure without a machine?
There are some risks associated with measuring blood pressure without a machine, such as misdiagnosis. Inaccurate readings can lead to misdiagnosis and inappropriate treatment. Inconsistency. Manual measurements may not be consistent, especially if taken by different individuals. Time-consuming. Manual methods may take longer than using a blood pressure monitor. While it is possible to measure blood pressure without a machine, the most reliable and accurate method is to use a blood pressure monitor. Alternative methods, such as the palpation method, are not very accurate and should not be used for diagnostic purposes. The auscultation method can be accurate and reliable when performed correctly but requires practice and skill.